Hello and welcome to the first episode of the Swasthya Plus Show. The Swasthya Plus Show is a platform where we talk to researchers, practitioners and leaders in the global public health system. Today we will explore various contexts, discuss about various challenges and the way forward as we try to improve health outcomes for everyone. Today I warmly welcome Dr. Rajiv Rimal, who is here with me here in Bhubaneswar. It's great to have you here.
Nice to be here.
Dr. Rajiv Rimal serves as the Professor and Chair of the Department of Health, Behavioural Society at the Johns Hopkins Bloomberg School of Public Health. Dr. Rimal works globally on social and behavior change interventions with a focus on gender norms. His work on social norms has led to innovative behavior change interventions in the areas of alcohol consumption, family planning, violence against women, and more. Dr. Rimal, it's indeed a pleasure to be able to sit with you here in the middle of this pandemic, in this phase of the pandemic, where it's safely possible for us to do so, and to talk about global public health. And again, I think to address right away the biggest health crisis of our times that we are living through right now, which what we've seen is a very unpredictable and evolving situation. As we talk today about human behavior and human health, how do you think the pandemic has advanced our understanding of how human behavior shapes human health?
Well, first of all, Sidharth, thank you for this invitation. It's an honor for me to come and talk with you today. You are absolutely right that one of the offshoots of the COVID pandemic experience that we've had in the last few years is that it has really brought behavioral science, the role of human behavior, to the forefront of public consciousness. If we look at the primary experience that we've had with COVID, it was really about what we as a human species do on a day-to-day basis. That is to say, our behaviors. Whether we were following government guidelines on masking, social distancing, vaccinating, all of these behaviors had a huge impact on our overall health and how quickly the pandemic spread from one location to another. So that's one aspect of it. The other aspect of what this experience has shown us is that it has depicted in a real way the fissures, the differences that exist in society between the haves and the have-nots.
Right.
And that social disparity that exists in almost every country, it certainly exists in India, has shown us that the most vulnerable in society, even before the pandemic, they were vulnerable because of so many other factors in their lives. They were homeless, or they didn't have access to health and medicine, or they were living in poverty, they were food insecure. So they could have been vulnerable in a multitude of ways. But one of the things that the pandemic showed us is that the people who were at the bottom of the social order in terms of vulnerability and access to resources were the ones who suffered the most. They suffered earliest, and they suffered in larger numbers than anyone else.
Right. So this idea of health outcomes being dependent on a range of socioeconomic determinants as well, and right, I think this understanding is not something new. Right, this is something we've known for a long period of time. But if you look at, let's say, social norms in particular, how do you think during the duration of the pandemic so far, how do you think sort of the changing social norms, and even if you can talk about gender norms, have really played out in our response to the pandemic and in general, how all of us have lived through the pandemic?
That's a really interesting question and something lots of people have given lots of thoughts to. It's something certainly that I've thought a lot about the role that norms, and as you say, gender norms, play in society. Perhaps it might be useful to first make sure we are all on the same page when we talk about social norms. What are social norms? So in the social sciences, this phrase has a particular meaning. Right. So social norms in that social science context usually means what people see and perceive in the social context in which they live, particularly with regard to how prevalent a particular behavior is, whether doing something is sanctioned or it's approved or disapproved. So all of these together form this idea of social norms. So as an example, in the pandemic, when we went to a particular venue and we did not know whether masks were required or not, we looked around. Very quickly, we assessed how many people in the environment were wearing a mask, and we acted accordingly. Most of us did that. So if we saw that most people were in fact wearing a mask, we put one on. And so there's just a small indication of how social norms play a role, right? This is particularly true when the course of behavior is unknown, when there's a lot of uncertainty about what is proper, what is improper, if we find ourselves in a new social environment in which we've never been before. And most of us have that experience when we travel to foreign countries. We don't know what the norms are. So we looked around to see what others in our environment are doing, and most of the time, that's a pretty good indication of what the right or the expected behaviors might be.
Right. So something again you're sort of trying to say here is that how social norms are very contextual, right? So what really shapes social norms in a certain context? If you can just tell us a little bit about that.
So it's shaped by a lot of things. One thing certainly is public policy and the enforcement of public policy. So I like to think of social norms as being different from laws, because laws also govern our behavior. The primary difference is that laws are codified in writing, and social norms are negotiated between people in their day-to-day interactions. So social norms evolve over time continuously. As we saw, so to come back to the example of wearing masks, norms changed from one time to another, as we all experienced. And oftentimes those norms, those shifting norms, don't just happen in a vacuum. They happen in response to something in the environment that galvanizes people to act in a certain way. So if we think, for example, about the online environment, there are very strong social norms that dictate what people do online and what they're allowed to do and what they'll get punished if they do.
Right.
So I see social norms as being present in almost every aspect of our lives, because after all, we are social beings.
So Dr. Rimal, again, a lot of your work is around understanding social norms, how social norms evolve, and to be able to, let's say, develop interventions that can shape these social norms so we can actually get people towards intended behaviors that can improve their health outcomes, right? So during COVID, can you talk about any approaches, how we have used, in the global context, how we've tried to understand social norms and then proactively shape social norms from our understanding or from the insights that we've gathered?
Earlier we were talking about gender norms. So let me talk a little bit about that, because I think that's very relevant. So we are just wrapping up an intervention in Angul district here in Odisha to reduce anemia among women of reproductive age. And the fastest way, the quickest way to reduce anemia is to take iron folic acid tablets. If you're pregnant, you take one every day. If you're not pregnant, you take one every week, and you will be in pretty good shape if you do that. So even a very simple behavior like taking a pill, what we found out very early on in our project was that that behavior is lodged in all kinds of gender norms. So for example, women do not normally equate feeling weak with having a disease. So, if I'm a woman, I'm working 14, 15, 16 hours a day. I'm sweeping the floors, I'm tending to the cattle, gathering firewood, etc. And it's natural for me to feel weak. Anemia as a disease does not even register. Second, as we know, in many parts of India, including in Odisha, women eat last in the home. And what happens is the norms around who gets to eat first, who gets to eat more, who gets to eat the more nutritious foods, the meats, the fish, those are also dictated by norms, and sadly, women get the short end of that. Right. Furthermore, women do not prioritize their own health. They tend to prioritize the health of their children, the others that they're serving as caretakers for. So even when they are anemic and they feel weak and they are not able to function, they do not think about seeking care, because seeking care is usually reserved for doing that on behalf of someone else.
Right.
So at any rate, so what we learned very early on was that even that simple act of taking a pill is actually lodged in this complex social network in which women are expected to do certain things, think of themselves in certain ways. And so the social norms intervention in that instance was about two things. Was, first of all, how do we get the community, all the people who are in the woman's network, her husband, her mother-in-law, her friends, the government officials who care for her health, how do we get all of them on the same team to say, you know what, we prioritize this young woman's health? So that was a huge shift in norms that we sought to change over the course of the project. Secondly, we also wanted to bring home this idea that this is a disease. It can have severe outcomes. And so we would test women, do finger pricks in villages, in their village once a month to 15 women, show their results in a chart to show at the aggregate level in the village what is the level of anemia. What is it this month compared to what it was last month, compared to what it was 6 months ago. And we also compared this village with their two neighboring villages to say, how come this village is doing so well or so worse than compared to the other villages? So what that did was it really brought to the forefront and the consciousness this idea of changing norms. You say, oh wow, things are actually beginning to change, so maybe I should get on board as well. So it was an intervention at both the individual level as well as more at the structural and social level, because we need both. And we see lots of examples of that in the COVID experience as well. Mm-hmm. So, who sought care, who got vaccination, who thought they needed vaccination, all of these were driven by what people saw in the media, what they heard, what they saw other people doing, and therefore decided was the best for themselves.
It's really interesting to really talk about this. And I think the understanding also here that I'm getting is that policy today certainly needs to be shaped around these norms, right? Social norms and gender norms. Policymakers, I guess, need to understand the context in which the policies operate and also shape policies. Since you've talked about gender norms and how policies really operate in this context, this awareness about the need to understand these norms, to be able to shape these norms and design interventions that are more effective in the Indian context and in the policy context, how recent really is this change in approach? Has this approach always been there, or is it really a fairly recent approach? And why do you think we are seeing work around understanding and shaping norms now?
I agree with you. I think much of this has been known, has existed for a while now. I would say at least 40, 50 years. But it's only recently, in the last few years, that behaviors and the importance of behaviors, the importance of social norms, the importance of communication has really risen to the top. That is definitely a recent phenomenon. I think the COVID experience also brought it to the fore in a big way to really understand the importance of behaviors. And there's also been a lot of activity in the social media world that has dictated how we approach this task. So I think in the last 5 to 6 years, there's been a confluence of factors that have come together to highlight the importance of focusing on behaviors. And one of the reasons why we want to do that, why we want to focus on behaviors, is that unlike a medical approach, a public health approach that focuses on the behaviors really takes a prevention orientation. So we try to do what we can to avert the threat. Yes, when there is a threat, we also need to respond, for sure, as many did during the COVID crisis. But I think lots of people are now asking themselves, what can we do to avert, to prevent the next crisis like this? And what can we put into place so that the crisis itself is less likely to occur?
So since the COVID experience, have we seen the role of public health at the policy level, but also at a population level? Are we now sort of rising and understanding the importance of public health?
We absolutely are. And as someone who works in public health, to me, that is music to my ears. And let me just give you a personal example at work for me. So I'm in a department that has many different master's and PhD programs. The master's program in Masters in Science in Public Health, we call it MSPH, that really focuses on behaviors. We used to run this master's program with 9 or 10 students pre-COVID. During the COVID time, the next cycle of admissions, we ended up with 42 students. So we saw this explosion in interest, and actually in the School of Public Health at Johns Hopkins, where I work, we have seen this explosion in almost every department that exists in the school. So it's as if all of a sudden the world has woken up to the fact that, oh, wait a minute, maybe public health is something I should also pay attention to. Because how we communicate with the public, what we do to avert threats, how we respond during a crisis, there are lots of behavioral aspects to that, and public health is a place where that is studied and practiced and used as intervention devices in almost every aspect of what we do.
So you're certainly seeing a rise in academic interest in public health, but if you look at the policy side of things, are we seeing an increased focus on public health at the global and national levels?
We definitely are, and I'm very happy to say that. So I'll give you a very concrete example. I am part of a World Health Organization's group called the Behavioral Insights Technical Advisory Group. So this is a group of about 30 people from all over the world who are interested in behavioral science, who are experts in their own sort of areas, that the World Health Organization has brought together for the very first time to give prominence to this idea of behavioral science and the role that human behavior, social and behavioral change, plays in almost every aspect of human health. And for me, it's really exciting time to be in this area of work because there is interest at the highest policy levels throughout the world in behavioral science. And in my conversations with officials here in India, I'm definitely sensing that people's eyes are opening up to the importance of this topic at the highest policy levels as well. So, for example, we are talking with folks at Niti Aayog on anemia in India, and they are keenly aware about the importance of approaching anemia from, among many different things, from this behavioral lens as well. So I think it's a really good sign, and it's a sign of things to come. What's around the corner for public health in India, which is how do we bring the best minds working in behavioral sciences to solve the public health problems of today and tomorrow of, say, climate change that is looming on the horizon as the biggest threat to humanity, and behavioral science has to be at the forefront of that.
Right.
So if there are young people listening today who are thinking about, what career is best for me, I would really urge them to think about the role that behaviors play in almost every aspect of our lives, whether it is in health, whether it is in democracy, whether it is in community empowerment, in almost every aspect of our well-being. Behavioral science is there and is going to be there in a big way in the years to come, and we'll need the smartest people from every corner of the globe working on climate change, because that's what's needed for us to save the planet.
Right. So again, COVID, I think, has brought everything together for us to really open the floodgates and do lots of work in this area. What do you think are the challenges as we go forward? And like you mentioned, as young people look at this as an emerging field, how can they really also get involved in this?
One big challenge for the kind of work that we do in the behavioral sciences to prevent diseases is that it is not as glamorous as rescuing someone from a burning building. Public health and behavioral science tries to prevent that fire from starting.
Right.
It tries to prevent the disease. And so it is not as glamorous, it's not as sexy a topic when we are trying to prevent something from happening, right? So a lot of the work that we do is behind the scenes. But it's very rewarding work, for sure, because we're preventing disease, we're prolonging human life, we're saving human lives. But what is, I think, different now is that at every phase of the pandemic, say from the preparation to what's happening during the pandemic to what's going to happen afterwards, the importance of behavioral science is at the forefront. So I talked about prevention for what happens before. During the pandemic, we saw lots of the roles of behaviors everywhere, right? In containing the pandemic, in ensuring that people are being protected. And then, after the pandemic, there will be a lot of work, a lot of pickup work. A lot of people will be having mental issues, mental health issues. Resilience will be a big factor during that time. And that's also where behavioral science is going to be absolutely critical in ensuring that people have access to the care they need, in ensuring that we don't stigmatize certain kinds of issues that people are having in recovering from this pandemic, and really in creating a healthy world for all of us.
Right. As we talked about health and also about climate change, I think communication as a center of trying to really change behaviors in this area to get people to care about climate change, to get people to act on climate change, and also regarding health, right? So if you look at the Indian context and also generally in the global context, health journalism also wasn't really an area that got adequate attention, but COVID has really changed that scene. Today, health journalism is a lot more vibrant and takes a lot more mind share and also gets a lot more resources than ever before. So again, I think if we can also talk a little bit about the role of communication and the role of media organizations in particular to sort of positively impact population health. And do you think as we move beyond the pandemic, is this interest going to sustain over time?
Communicating about what lies ahead for all of us in terms of the devastation that this world is going to see because of climate change. That communication effort is going to be absolutely critical, because it's not only about raising awareness about the problem, because I think most people kind of know that this is happening. So I'm not sure that the problem is about raising awareness, but it is about raising awareness about solutions. Because the problem is there, yes, we all know that. I think people are asking themselves, what can I do? I feel so powerless. I'm one person, and here are huge companies and governments making policies about pollution and fuel. And so my effort seems minuscule compared to what is happening at the larger, broader social level. And that's where communication for mobilization comes in. Because yeah, it's true, as an individual, there may not be a whole lot that I can do. I can change my behaviors, I can reduce my consumption, but that only goes so far. But I can do a lot in bringing people like me together to form communities, to form advocacy organizations, to advocate for friendly policies, to knock on doors of policymakers and put this at the forefront of change for the future, continuous attention on this issue. And like I said, I think a report just came out from the UN about the state of the world with regard to climate change. And once again, the report very correctly highlights all the problems that are happening. But I would say it's now time for us to think about solutions and really put solutions at the forefront of climate change. So what are the innovations that we can unleash among our young people who have so much at stake, who have so many innovative ideas? What can we do to empower them to take action? And that is all about behavior, right?
Right.
And so I think we need to create spaces where young people can come together, can mobilize, can act, and really lead the way for future public policy on the biggest threat that confronts us.
Right. Coming back to health again, how do you think, what really is the role for media organizations to play around health journalism, and how do you think media organizations can actually play an outsized role in ensuring that people have adequate health literacy and they can actually make informed decisions about their health?
So I think there are at least 3 or 4 ways in which media organizations can play a very productive role. The first is to shape the conversation menu, if you will, to shape the agenda, to set the agenda so that we are continuously talking about what is important to us. So it's not just about covering, what bleeds leads. It was a good dictum, but I hope we've moved beyond that to say now we need to also think about what we need to put out there for the public's consumption. So that's setting the agenda is a very important part of that, important responsibility. The second is, how do we frame that message around the issue of the day? And what research has shown us is that for something to be actionable, for a health issue to be actionable, for example, there needs to be 2 components. The first component is you raise the risk. You make people aware about inaction or action. You raise awareness about what is at stake. Then the second part of that is you provide the solution. So you cannot just scare people and think they'll take action. No, if you scare people, you have to give them a solution so that they can act on it.
Right.
So that's the second. How do we craft those messages? Third is when I've talked to people and done interviews about various health topics, what people often say is, say for example in the area of climate change, tell me what I can do.
Yeah.
So providing that solution that is at the local level, that is tailored to the individuals with whom you are talking, is absolutely important. And then lastly, what is also really important is to localize the topic. And what I mean by that is for something as broad as climate change, if it's not put in the context of what's happening in my town and all the health effects, the asthma effects on my children, then it's not going to be very meaningful. If it seems like it's happening in a distal place,
it's too far away.
It's too far away, and people will not be motivated, right? So, localizing the problem, localizing the solution, providing people with specific actions that they can take, and then lastly, facilitating those behaviors. So it's not enough to say, talk to your government official. No, you provide the number. Here's the number to call. Here's the email. Here's where their address is. Their office is open from 9 a.m. to 5 p.m. on this particular address. So you really facilitate the behavior, then people are more likely to act.
Right. So again, we've discussed a lot about how research around behavioral sciences are actually helping us understand more about social norms and how we can shape social norms and how we can nudge behaviors, whether it's around health or around climate change. I would like to again discuss from a practitioner's perspective, how far have we come in also trying to ensure that the insights from these research actually become actionable and can reach practitioners like media executives or policymakers, and how important do you think that is in this entire conversation?
I think it is vital in the following sense, and this goes to what we were talking about earlier about the recent emergence of behavioral science. The science part of behavioral science actually has a long history. It has, there's at least 100 years of really solid behavioral science work. But most of that work lived in academic journals. And academics talked about it, but it didn't really come out into the open. And it's in the last few years, particularly during COVID, that ideas from behavioral science have come to kind of the layperson's desk, if you will. And policymakers are all of a sudden being very aware about the importance of behavioral science and designing policies to facilitate behaviors, right? So I'll give you an example from architecture. So when we design a building, in the old days, they used to put the staircase way at the back of the building, if you're designing a very tall building, 9 or 10 stories building, the tendency was to put the stairways back on the back side of the building, dimly lit. Everything about the stairway said, "Don't use me." Now, modern buildings are putting the stairway right at the entrance, making it attractive, making it wide, making it well lit, and everything about the staircase says, "Use me." And guess what? People are much more likely to use it. So that's a small example of how architecture has also adopted behavioral science, and that is all about facilitating the behavior, right, and making it normative, the norm, to take the staircase rather than to take the elevator as a way of staying active. And so that's just one example of how behavioral science is now seeping into many different aspects of our lives. And lots of policymakers now in city planning, for example, think about spaces and public parks and running spaces and so on as an integral part of the design. And in many cities, unless the architectural plan comes with those kinds of things, it won't even be approved. So I think we're beginning to see action on that front to really bring behavioral science and what it has to say to the public domain. And that's also, I think, very exciting.
So following up on that question, so how can small organizations or even individuals who are trying to influence change in their communities really leverage the power of behavioral sciences and insights from behavioral sciences when they are sort of looking at solving a certain problem, etc.? How can small organizations or individuals do this?
Most of the problems that we are trying to solve, whether it is in health or in other domains, are multifaceted, right? If it were a simple problem, we would have solved it already. These problems are often very complex, which means that we need the players in that sandbox of solutions have to come from multiple areas of society, from religion to civil society to policymakers to everybody who has a stake in that has to be a part of the solution, right? So if you're a small organization, one way to think about the solution is to think about what can I do at the individual level, what can I do at the community level, and what can I do at the policy level. At the policy level, even if you are an organization that does not have lots of money for lobbying, you can still serve as the squeaky wheel. And let me tell you, if you're squeaky enough, you will be heard, right? So there are ways of making yourself heard by the policymakers. At the community level, I think organizations can think about how to link existing resources. There may be women's groups, youth groups, and others that if they can mobilize them to act together, oftentimes it's not just a matter of resources. Yes, there may be resource challenges, but it's also a matter of not being organized and not coming together as one large entity. So I think organizing, using social media to organize, that's another solution. And then at the individual level, there are lots of things that I talked earlier about. How do you communicate about the problem you're trying to solve? So couple the problem with the solution, and you're likely to bring people on board.
What do you think are the challenges there to get young people involved in research, to get young people interested about public health, and to work on improving the health of their own communities? And what also some ways you think we can go forward in this area?
So there's a lot packed into that question. Let me take different elements, one element at a time. So let me start with the research, because that's something that is near and dear to me, just given the work that I do. And in my public health work in rural parts of India, in Africa, and in many other parts of the world where I work, there's one thing that I have been constantly struck by, and that is among the young generation, young professionals, the hunger that exists, the curiosity that they have about the world, to want to learn more. And given the nature of the work that I do, I encounter a lot of young people, a lot of young women in particular, who perhaps have not had the formal training in research, but are very curious about what they can do, how the world works, what is effective, what is not effective. And so I think there is an incredible opportunity from a higher education policy kind of perspective to create avenues where young people are rewarded for their curiosity. I think in many parts of the world, including in India, school systems are designed to answer questions, not to ask questions. We reward students by the extent to which they come up with the right answer, the right solution. And in many ways, that does a lot of disservice to that particular student, because what it says is, if you know the right answer, you're done. That's it. When in fact, that couldn't be further away from the truth. Because research is really about, I think I know the answer, but I'm not sure. I wonder how this works.
Right.
And it's that sense of wonderment and curiosity and openness that we want to inculcate. So I think we have, as a society, we have a lot of work to do to shaping our education system so that it rewards curiosity. It rewards people ability to ask questions, and to create a culture. And earlier we were talking about norms. How do we create the norms in a classroom where asking questions is really encouraged? So it starts from that. Mm-hmm. And so what I've noticed is, young women who are working in public health, doing really important work in public health, want to better their career, and ask me all the time, what do I need to do to get into a school and get a public health degree? And what can I do with that degree? For people who are already in that field and are contemplating, should I go work in the public sector? Should I work in the private sector? Should I do further education? So these are some of the questions that people often ask me. If we can create this culture where we promote curiosity and we promote the idea of asking questions, then I think we truly innovate and we unleash all the powers that exist among young people to try new things, to fail, to learn from our mistakes, and to try something else. So I think that's one layer of this that is a very sticky problem that we need to start really thinking about in earnest. Then, secondly, for people who have a degree and maybe are really interested in research, where do they begin? Where do they do that research? How do they do that research? In many Western countries, there's a very strong culture of publishing in peer-reviewed journals, and there is some of that in India, but I think there could be a lot more. And that is one way of rewarding success in that area, is when your peers recognize that the work that you do is actually worthy of publication and dissemination. So that's another area where I think we could spend money training our young professionals how to do the writing, how to do the thinking, and the publishing. Then the third is, just writing academic articles is definitely, it's great and it's needed, but it's not the only solution. We also need people who are able to take oftentimes very esoteric writing and translate that for the consumption of the layperson. So that's where communication and health communication plays a very important role. And the ability to talk to people who may not have a high level of literacy in a particular topic. So oftentimes, even very smart people and very well-educated people have blind spots when it comes to certain topics. They may not be knowledgeable in those topics. And so when we design communications, we really need to think about how to design those materials and make it come alive for people whose health literacy may be very low. And what research has found is that even people who are highly sophisticated if you present them simple language materials, they actually prefer that and they like that better than a material that is inaccessible to most people. I think if we can get people behind this idea that it's okay to ask questions, it's okay not to know, and it's okay to make mistakes. But the critical thing is, what do we learn from those mistakes, right? And so I think at every level, our institutions must really create a culture where that can thrive. And even if you're a for-profit institution and you have a certain set way of doing things, there's always room for innovation. There's always room for doing things more efficiently, doing things in a more humane way, bringing people together, retaining your staff. All these are questions, even in this COVID environment, these are questions that have really come up, right? And none of that is going to survive in the long run if we create a culture of stagnation. We have to constantly create a culture of movement and a culture where people are encouraged to think outside their comfort zone and create and have institutions create environments where those kinds of thinking are actually rewarded and it's not punished.
So Dr. Rimal, we've been also working on understanding norms around vaccine uptake, especially in a context like India, in a context like Odisha, and how we can understand social norms to ensure that we increase vaccine uptake, especially in the context of COVID-19, where it is one of the strongest weapons in a fight against the pandemic. Can you talk a little bit about your work around this?
Sure. So I was lucky to be able to be a part of this fabulous team in Odisha, in which we shot videos to depict vaccine information in a new and novel way. So I think when most of your viewers think about vaccine messages on television, they often think about government dictums that tell them what to do, what not to do, how the vaccine works, and so on. They probably don't think about it as something to be entertained by. So we took that approach to say, can we tell a story of a family that is celebrating the birthday of a young child and a normal conversation that's happening in that context, where the conversation turns around vaccination and we have someone who is resisting taking vaccine shots, and someone else a young person who's trying to persuade this older gentleman to get vaccinated. What was fascinating to me was we had the opportunity to shoot this video in 8 different ways, with a male person advocating versus a female person advocating, doing it either in a very humorous way or doing it in a serious way, and then catering to either the individual level risks and benefits of getting vaccinated versus thinking of the risks of COVID not to the individual but to the society, and the benefits of getting vaccinated not just to the individual but to society. So we had a lot of fun creating these 8 videos, putting them on Swasthya Plus and other places to see which of those would be very effective. And what we learned was also very interesting. We learned that it's actually possible to use humor to talk about something as serious as COVID-19. Using humor can go a long way in addressing some of the skepticism that exists. That humor can break that barrier and bring people on board and reduce their skepticism. So it was a fun project, and I hope we get to do more of that.
So you work closely on vaccine on this project here in Odisha. If you actually compare the context of vaccine skepticism here in India or in Odisha with that of, let's say, in the United States, do you have any comments on how do you see things that are similar? Do you see things to be radically different? What do you see?
We started this project in India, the idea in India, because We had heard about lots of disinformation campaigns on WhatsApp and other venues. And we know that disinformation around vaccines is a huge issue in the US and Europe, in many parts of the world. To our surprise, we did not see a lot of that, at least not in our study, in India. So I think that information, the issue in Odisha at the moment seemed to be much more around access to the second dose and the booster dose than it had to do with skepticism. So I think that skepticism appears to be far less in India than in other places. And in other places, like as we know, there are actually concerted efforts to disseminate incorrect information about vaccines.
I think it brings us back to the fact that we really need to understand different contexts deeply to really respond in very different ways to the same large problem that we have been facing, COVID-19.
Absolutely. I think how we react to these kinds of messages depends a lot in what is happening at the moment, what our social context is, what our living situation is, what access to information we have, what we bring to that interaction. Absolutely.
It has been a great time talking to you about global health, talking to you about your work around changing social norms. Thank you for joining me here today.
Thank you for giving me this opportunity. It was a lot of fun. And I really hope that someone listening to this conversation today gets inspired to ask that question and say, start their sentence with, I wonder. I wonder how things work. I wonder why that is so. I wonder why that is not so. If we can do that, we'll have achieved a lot.
Thank you everyone watching this. This was the first episode of the Swasthya Plus Show. We had with us Dr. Rajiv Rimal from the Johns Hopkins Bloomberg School of Public Health, talking to us about global health and how all of us need to be more curious and build a healthier world for everyone.